Well, you don't have to go under the knife to look younger. There are some less invasive options out there, and Dr. James Nachbar, he is here to share some of them with us. And we are talking about Botox and fillers. Welcome back to Sonoran Living.
Thank you, Andy.
All right, so we often hear about Botox as some sort of a magical rejuvenating potion. What does it really do?
It's really, really simple. All Botox ever does is weaken temporarily paralyzed muscles. That's all it does. It doesn't lift, it doesn't plump, it doesn't do the same thing as the fillers. It merely weakens the muscle. So it goes in, it interferes with the connection between the nerve and the muscle for a period of about 3 to 4 months. It takes about 4 or 5 days to work, and it's very, very simple.
Are there any products out there that do the same thing as Botox?
Sure. Botulinum toxin is the basic active ingredient of Botox. There's another product called Dysport. There are other products that are similar. They're not used as much in cosmetic areas, but certainly the botulinum toxin A's, like the Botox and the Dysport, very, very similar in how they work.
Okay, but you use Botox.
I use Botox,
at your practice.
but Dysport's also very fine.
Okay. All right, so what areas can we use Botox on? Because let me just also say, you know, we're talking about how you don't have to go under the knife. So obviously we can use Botox to do certain things and help us look younger. What are the areas that we can use it?
Sure, works really well in the upper face. So the area, my favorite area is the area between the eyes, right here, where it works. In fact, that's actually a picture of me. I did my Botox on myself.
You're making your angry
face? You have to do that. If you're not tightening your face, you're not going to be able to see the effect of Botox. So remember, Botox only weakens the muscle, so if you're not tightening that. So you can see in the before, actually that picture, the before picture is the day after my Botox injection, because I didn't think to do the picture beforehand.
But you can still see.
But obviously Botox
lines.
doesn't work for a couple days, so that's the lines you get before, and then after 3 or 4 days, you can see what basically those lines are not there.
Now, can you use it on cheeks or lips, or?
Sure, you can use it on other parts of the face, but you have to be really careful. You don't want to have a paralyzed face, and that's what it can do. So a little bit around the lip may work in very select patients, reduce some of the lines, but it's going to make it harder to use a straw and so forth. So that's not as popular an area, but very popular in the forehead, the glabella area between the eyes, and the crow's feet areas on the side.
Exactly. You definitely have to be careful to what you're using, who's using it on you as well. Okay, so if Botox isn't the best treatment, what is sort of another option, or fillers, I guess we call them?
Botox is a great treatment for what it does, but fillers do something completely different.
Okay.
They basically, as their name says, they fill things out. So very, very effective in, like the nasolabial folds here, to fill that area out. People use it in the lip area. It can be used in the cheekbone areas, a little bit in the cheek. With aging, we find it's not as much even sagging. Often it's loss of volume. If you do the very careful pictures with people before they age and then after they age, the big difference is not so much skin sagging, but really loss of volume.
Right.
So Botox, for the fillers, are very, very good for that. They'll also work in the area below the eye.
So would you use the fillers sort of as an alternative to a facelift?
Can be, definitely.
Okay.
Some people will call it a liquid facelift, but early on treatments, most people are going to do the fillers before they're ready for a facelift.
Right. And I know we've got some pictures just so that you can see before fillers and after. What a difference, right? Especially right there in her. What do you call these lines?
The nasolabial folds, or some people call them parentheses. These pictures on this side about the fillers are all by the Juvederm company, so these are not my patients. All these pictures basically show that. So here's another patient who has had the filler put in the nasolabial folds or the parentheses area, and you can see how that area is really nicely smoothed out. And a young patient, obviously not a candidate for a facelift, but a great patient to use a filler like this.
You know, and some people just really, really want it. You know, other people may say, oh, you don't look that bad, but for everyone is just so critical of ourselves, right?
Well, sure, and obviously someone like this very quickly in the office in a few minutes can get this treatment. You know, she feels better, she looks better, and there's really no reason to deny her that kind of treatment. It's cost effective and very, very good.
Can you use it together?
Absolutely. Botox and Juvederm and the fillers can be used together, and very useful that way.
Now, I know you sort of have a warning. Be careful of who is actually doing your injectables, and you actually do them yourself.
Right. In my practice, I do all my injectable treatments myself. I do all the treatments, in fact, in my practice by myself. There's nobody else doing treatments of any sort, really, in my practice besides myself. So I do think it's important to pay attention to who does any treatment. You know, we talked before about picking a plastic surgeon. The same thing really applies here. Some people think, well, it's just just injections, it's just Botox, whatever, things can go bad. And we were talking before, you had a bad experience when someone did Botox, and of course,
it freezes your face. You
right,
have to definitely be careful.
For 3 or 4 months. So,
right.
And there's really nothing you can do but wait. The fillers are the same thing. In fact, there can be some serious medical complications, actually tissue loss and so forth. And so it's very important to pick the person doing that.
Yeah, you don't want to learn the hard way, that you should have picked someone that really knew what they were doing. Thank you so much. You can find Dr. James Nachbar, his information, Scottsdale Plastic Surgery. The number is right there on your screen at 480-289-5300, or you can go online at plastic.org.